Good morning. Good morning. All right. Jim, I got a greater response. Welcome to all of you. Let me begin by saying that this forum is one of my most favorite forums because of the work that you do, and you heard the long history. It's been so relevant and ever more relevant today, particularly with the issues of infectious disease outbreaks, etc. And at the National Academy of Medicine, along with the other two academies, we certainly strongly believe in collaborative activities. So this is one such example of working across with engineering sciences and medicine on an issue of big data analytics for infectious disease research, operations, and policy. And many of you know, last time I spoke to this group, maybe not the last time, one of the times I spoke to this group, was launching the Global Health Risk Framework that you play such an important role. And I would tell you that, in fact, that report has an enormous impact in terms of getting the attention, if you will, of the policymakers, stakeholders, and importantly, world leaders in terms of moving forward with some of the changes. One of the areas we talked about, of course, is investing heavily into preparedness and response, but also the area of research and development. So I think this conversation today on big data fits beautifully into the need to bring in these technology sciences into, in fact, infectious disease area in order for prevention and prediction, etc. I want to begin by thanking, in fact, the Forum Microbial staff who put together this effort, particularly Guru Medvedev, that you know, Ayona Ogawa, and Priyanka Nalamada, as well as Ellison Berger and Patrick Kelly. But of course, importantly, Lonnie King, who is the Workshop Planning Committee Chair. Thank you very much to all of you. I think it's a very exciting time for all of us, from both the health aspect and also from, as you hear, from engineering and sciences, that in fact an exciting time for big data. Large sets of data that can be captured, communicated, aggregated, stored, and analyzed. The amount of data in the world has really been exploding in recent years. For example, companies are churning out large volumes of data, transactional data, capturing trillions of bytes of information about customers, suppliers, and operations. Millions of network sensors are being embedded in the physical world in devices such as mobile phones, smart energy meters, automobiles, and of course industrial machines that can sense, create, and communicate data in the age of Internet of Things. Indeed, as companies and organizations go about doing their business and interact with individuals, they generate a huge amount of digital exhaust data. That is to say, data that captured as a byproduct of other activities. There's social media data, smartphones and other consumer devices, including PCs and laptops, had again allowed billions of individuals around the world to contribute to a large amount of a big data set. And so the growing volume of multimedia content play a major role in explosion and exponential growth in the amount of big data. So where do we stand in health? Well, the global health system is a big driver of growth in this area. Vast amounts of data are now being generated by clinical encounters, payer activity, cost data, pharmaceutical medical products, R&D data, and patient behavior. And this is important because the sheer volume of data is because not only the information itself has the potential of actually providing insights and generating ideas, if not evidence. So in the business world, of course, with analytic tools, they can be extracted to have meaningful insights about the world around us and generate value for every sector. Now, particularly, of course, not only business world, but health. Also, data can provide us with more affordable and accessible than ever the data, and we're at a tipping point where I believe that big data can revolutionize society. So, this way these data can be leveraged in so many different ways. The question is the application in the health and medicine. And they're tremendous. You think about prevention, to treatment, to address global health challenges. So with prevention, for example, the smartphone apps measuring how far you walk in a day. You know, all of us have this, and I can tell you how many steps I walked today. And to calorie counts to help you plan your diet. And millions of us are now using mobile technology to help us try and live healthier lifestyles. More recently, a steady stream of dedicated wearable devices have been emerged such as Fitbit. I'm sure many of you can show me your Fitbit, Jawbone, and Samsung Gear Fit that actually allow you to track your own progress, if you will, and update your data to be compiled alongside everybody else's. So ever-growing database of information about state of the health of the general public will allow problems to be spotted before they occur and remedies to be prepared in advance. What about treatment? Well, the next generation of clinical decision support mines data to recommend treatment. For example, IBM Watson Oncology analyzed the meaning and the context of structured and unstructured data in clinical notes and reports to help clinicians select a treatment pathway for their patients. So finally, of course, big data can be used to manage global health risks, something that we all care so much about, from antimicrobial resistance to pandemic preparedness. Antimicrobial resistance, as you know, is one of the most pressing health concerns, and of course, big data can be used to optimize drug development to prevent AMR, and doctors, maybe in the future, can use predictive software that can tell them which medication is most likely to work for each patient. And the area of global pandemic infectious disease, you know, there are very few risks in mankind that threaten lives at the scale of pandemics. I recently gave a talk and really realized that if you look at, you know, Spanish flu and HIV, I don't think any war has ever killed as many people, you know, as you can imagine in pandemics. But also, I think we need to think about the economic and security impact, as our report has done. So how do we really make sure that we prepare and detect and respond to infectious disease? Well, some of the lessons learned in Ebola, I think, is quite startling, because as you know, in December 2013, the first case of a 2-year-old child was first seen in Guinea, but it was not until August 2014 when the WHO declared public health emergency of international concern. Now, with new approaches with big data, we can leverage this data, which have the potential to improve disease surveillance, enabling more timely response to these outbreaks. Big data could capture $9 billion in value every year in U.S. public health surveillance alone, according to McKinsey report. Traditional epidemiology used data from field investigators, surveys, and hospital records. They're time-consuming, they require a lot of manpower, boots on the ground, and they're obviously always behind. Health officials usually investigate cases to identify cases and source of infection and prevent transmission. But as I said, they're typically difficult and time-consuming. I think that the big difference in the possibility of digital detection is because using that, whether social media, internet, research data to catch and really track outbreaks, and it may buy us a lot of life-saving time. So I think that clearly that we can imagine we can unlock the potential by really using big data. Now, there are some challenges which you discuss. Typically, questions related to usage, access, interoperability, analysis, quality, validation, storage, privacy, and liability are those questions. Also, the purpose of this workshop is to hear about opportunities and challenges in big data, as well as perspective from other sectors. So, as you can imagine, there are many industries that are well ahead of health in leveraging big data. Google, Amazon have certainly taken advantage of big data to tailor their products to certain audience and provide customer experience. Why can't we do the same? And there are many lessons that we can learn from other industry, and that's probably why you have people from different industry here discussing this. So we can apply it to health, to infectious disease research, operations, and policy. So I'm really glad that you put this meeting together. I think it is such an important issue, and thank you for allowing me to frame the workshop agenda. Thank you.